Hello, my name is Rachel Cairns. This is my Learned Changes Reflection video. Part 1. Evolution. How has your understanding of nursing leadership and management evolved during this course? My understanding of nursing leadership and management has evolved because I am able to determine between the two. It always seems that when someone is a nurse leader, you affiliate them with management, which is not always the case. It is possible to be a leader within an organization without being a part of management. I have also learned about the different types of leadership and their specific characteristics, such as transformational leader, democratic leader, laissez-faire, and authoritarian. I have learned more about patient-centered care, ethical dilemmas, quality improvement, and nursing theories. Implementation. Which specific leadership or management conflict tools or skills do you plan to implement into your nursing practice? Some of the specific leadership and management concepts, tools, and skills that I plan to implement into my nursing practice is using bedside shift report more frequently. I also hope to develop my emotional intelligence more to establish more effective communication by taking a step back, thinking about what I'm going to say, evaluating the outcomes, and saying it as respectfully as possible. I think that I would like to embrace chaos more and learn how to handle chaos more effectively rather than getting frazzled. I think by asking myself some more quality improvement questions, such as what happened, how it happened, what to do if it happens again, and what can I do to prevent it in the future, would be great to implement into my practice. Developing a stronger nursing practice based on ethical and moral situations is something that I would like to implement as well, by asking more about how I feel about a situation and why I feel this way. Future growth. What is your plan for continued professional and personal development as a nurse leader? My plan for continued and professional and personal development is to eventually work in an ICU and maybe get my CCRN certification. I have absolutely no desire to be in a management position at this time. I would like to develop my critical thinking more effectively and work more on my emotional intelligence at this time. I would also like to ensure that I follow through on tasks more and do not pass on to the next shift unless necessary. I'd like to communicate more effectively with members of the team when it comes to shift reporting and things that need to be done. I do follow the SBAR method, but I do work on a busy unit and things get omitted due to chaos and frazzlement. SLO1. Systematically appraise principles of leadership and management as applied to nursing care delivery. Leadership and management are two separate entities but coexist within each other. Leadership can inspire a team to move in a certain direction through the characteristics of an individual to achieve a common goal. Management is a job where you focus on competency, standards of care for patients, monitoring and tracking employee work, budgeting and balancing nurse-to-patient ratios, and more. To work in management, an individual needs to be capable of balancing all aspects within a workplace, such as management of client care, delegation, conflict resolution, evidence-based practice, and quality improvement. SL2. Collaborate with clients and interprofessional teams to integrate evidence-based practice promoting quality care. Some of the ways that we can collaborate with clients and interprofessional teams to provide evidence-based practice and promote quality care is by ensuring that we are offering patient-centered care. Having patients included in their health care decisions and ensuring that we are using standardized tools such as the SBAR method, which is Situation Background Assessment Recommendation. When giving reports on patients, it is also important that we continue with our education to ensure that we are evolving and learning new things to help patients. SLO3. Lead a safe environment by collaborating with the interprofessional teams, integrating safety-enhanced technology to deliver quality outcomes. Some of the ways that nurse can lead a safe environment is ensuring that there is transparency of communication between the interprofessional team. One way to safely enhance communication is by using things like the Situation Background Assessment Recommendation, the SBAR method of communication. Another way is to use the bedside shift report by being in the patient's room and having reports in front of the patient. It is also important to have safety on a unit by having an open door policy where if nurses sees anything wrong, that they can go to their supervisor without risk of retaliation. SLO4. Model a variety of leadership and management, professional and therapeutic communication modalities, collaborating with the interprofessional team. A transformational leadership style empowers and inspires our team to achieve change. Transformational leadership is something that is long-term and focused on the long-term growth of an individual. A democratic leadership style includes all the members of a team to make a decision via democracy. An authoritative leadership style is where the leader makes a decision. The team output is normally high, but the team morale tends to be low. Some professional communication includes methods such as SBAR method, closed-loop communication, and active listening skills. One important component is to remember the 4 C's in communication, that is clear, concise, correct, and complete. Ernst Mayr, ETL 2024. SLO5. Appraise through principle of leadership and management, interprofessional teams administering client-centered care, focused on patient, staff, organizational values, beliefs, and preferences. When it comes to leadership and management, some of the things to focus on when it comes to patients is ensuring that we are offering patient-centered care by having honored both patient, staff, organizational values, and beliefs and preferences. A nurse must ask themselves, what do I find right and wrong? How do I feel about the situation? By being aware of how you feel about the situation, you can determine if there is an ethical issue and then follow up and ask for help regarding the situation. If you find yourself questioning your values, beliefs meet an organizational's values, beliefs, and preferences, then there could be ethical conflict which could affect your client care. It is important to ask patients directly what they want when it comes to their preferences, so that way you can honor their values and beliefs without causing an ethical dilemma. It is best to ask the patient directly rather than to assume. Asking a patient what they would prefer in their care can help build their autonomy, esteem, and self-worth. Some cultures are different than what an individual may practice in their own culture. It is important to have inclusive attitude and honor their practices. Some employees may have different ethics, morals, values, and cultures. It is important to keep in mind that not all employees are the same. There can be different conflicts when it comes to workplace conflict. By practicing cultural humility, leaders can create an inclusive workplace environment. The rule of thumb is to ensure that their practices are honored if it does not cause harm to patients and staff, does not impede on the rights of others, and follow the American Nurses Association Code of Ethics. SLO 6. Implement personal and professional behaviors influencing intentional change guided by leadership principles and theories. Some of the personal and professional behaviors to influence change are changing every day and being open to change and not being afraid of change. Change is not always a bad thing, and sometimes there are things that need to change within a workplace. By having effective change within a workplace, it can help inspire the team, improve patient care, make quality patient care more effective, and follow healthcare standards. Some of the leadership theories regarding change would be like the Lewin's theory, Cotter's change model, and the Lippitt's 7 steps. It is important that when things start to change, you are reflecting on what needs to change, why it needs to change, and what could be done differently, and how this will affect others. It is important to be open to feedback and open to communication so it can be determined if the change works or not. References: Ernst Mayr K., Chrisman E., 2024. Nursing Management and Professional Concepts, 2nd edition, Wise Tech Open.